are so lucky that Thailand is an agricultural country. This also means that whatever we grow inside our garden, we can transform them into traditional medicine. And welcome to World Within, a program that will update everything you need to know about health from top to toes and from the inside through the outside. And for today's program, we're going to have a look at how the traditional medicine is made over here at the Abhaibhubejhr Hospital. At the Abhaibhubejhr Hospital, there are two ways to prescribe traditional medicine for the patients, which are first in tablet and second in a traditional natural way. For patients who have trouble consuming the medicine and do not like its smell, the doctor will then prescribe the herbal medication which has already been extracted and packed in capsules.
In Abhaibhubejhr, we have two concepts. The first one is we apply traditional knowledge into the product. Is more modernized product like a capsule, a tea bag, which more convenient for people to use. And we also promote the traditional way. Right. We set up the traditional pharmacy for practitioners to practice their own traditional knowledge. Like we use dry herb, we use many dry herb make as a recipe, and then the patient have to boil at home. Or in some case, we also promote the do-it-yourself. It's like a homemade recipe. We teach not only patients, we teach people to do it at home, to know the property of the herb and to know how to use that one.
However, at the hospital, the production standard is very important in terms of quality control and sanitation, especially for producing the herbal tablets. Everything has to comply to standard.
If you want to scale up into the industrial scale, it might be concerned about the standard of production. So it might be harder than homemade style. So when we scale up, it might need GMP or good manufacturing practice. We must have quality control for the raw material, for the active components, and in many things like the sanitary of the production process. So it might be difficult and must be more aspect to concern, not only the property of the herb.
The hospital combines the modern practice and traditional practice together. According to a pharmacist, traditional medicine is not always less effective than the modern one. Some of them act as an immediate relief.
The most popular herb that we use is like turmeric or Kamin-chan. It's very popular for flatulence, for dyspepsia or stomach upset. Right. And we also use makham pom. Makham pom is a cough syrup, which very widely used many years ago. But nowadays, people may not know about this. But Abhaibhubejhr, we're quite concerned on this indigenous knowledge. We know that it's very useful for sore throat, for flame. Yes, it's like that. It would be very helpful. And we conduct the clinical trial compared to modern medicine. It's called ambroxol syrup. The efficacy is the same. So we try to promote the use of makham pom syrup instead of ambroxol syrup in our hospital.
And that's it for today. I hope you enjoyed the program and see you again next week in World Within. สวัสดีค่ะ